on IV site labeling and also IV tubing labeling. Before, when you come over and you get report, make sure all your patients with IV tubing, we have to help each other change the shift. If there's a bag, the bag should have the patient label, the date, the time, and the nurse's initial. If this is non-medicated IV fluid, we have for 96 hours. That's why we're timing everything. If there was medication in the bag, we have 24 hours. That's why time is important, because if you hung it at 11 o'clock at night on the 23rd, you have until 11 o'clock at night on the 24th. The IV tubing, for instance, if today was, I don't have the date you put for date and time is the date you hung it, and then the change date, if it was non-medicated fluids, would be 96 hours. If it has medication, it's 24 hours. When you're looking at your site every day, make sure as nurses, there should be, you're assessing, you're going to flush every day, you're assessing for signs and symptoms of infiltration, but you're noting the date it was put in, and there should be an RN signature. In the documentation in EMR, we have to make sure the date, the gauge, the location. Very, very important. The parameter for IV insertion has to be done daily, and all parameters have to be answered. Okay. ESSU team. Today we just want to go over that everyone can verbalize the process if you get a order for an IV push medication. I know you're all doing it, so this is just a review. You would go, first before we give any IV push medication, we have to make sure the order is appropriate for this unit. So right now I'm in CSSU, none of the patients are on tele. So I just received an order for Lipressa 5 milligrams IV push. So what I will do, and everyone should do for every IV push medication, we're going to go to the internet page, which is all the nurses' home page, and we're going to go to hospitals and facilities, and I'm going to hit LIJ Medical Center. Then we're going to come down to the next page, and I want to find pharmacy, because as I told you, pharmacy has the best website in the hospital. And we're going to come down to the middle of the page under IV medication information, and we're going to hit LIJ IV medication guide, and it was last updated, as you can see, on February 22nd. We never print this out. This is a live document, and we're just going to open it, and it's going to be very small, and we can make it bigger, but I just want to show you the red is what we're going to look at first, because it tells you if you can give this drug on your unit. We're going to do Lipressa. I'm going to hit Control F. It's just, you can go in alphabetical order, or this is a shortcut I do. And put Lipressa in and see how it comes highlighted, and I can make it bigger so we can see. So this is the generic name we all know is Metapropyl, the brand name. This says episodic monitoring, blood pressure, and apical pulse. So this is very important. You have to do an apical pulse. I'm going to go up and I'll show you episodic monitoring. It means we have to do vital signs before and administration, and within 10 minutes after. This doesn't say apical pulse, but where you would document heart rate, you would say that it was, I believe there's a term they use. Can you stop that? I forget the term they use in the document. What other information do we need? We don't have to worry about labs. We have to know how much we're allowed to give up IV push. We're allowed to give up to 5 milligrams. And then the next question should be how fast. So right here it says 1 milligram a minute up to 5 milligrams. My order says 5 milligrams. So I know I need to push it over 5 minutes. I need to, when you're given an IV push medication, make sure you're wearing a second-hand watch. Okay. If you did have the computer nearby just to show you, if you could see this, but I don't even know if you want to even go there. This is in, we just show them. Okay. So we have determined that we can give, did my vital signs, the apical pulse was in the 70s, I determined I can give this medication. I do my vital signs, I put it in my flow sheet, and now I'm going to go. Before we drop the medication, I'm going to pause the Alaris pump and clamp. Hand hygiene for 15 to 20 seconds. My hands are completely dry. I'm going to put on my gloves. I'm going to flip off this dust cover. I'm going to scrub for 5 seconds and let it dry. I'm going to draw up my medication. Make sure it's the correct 5 milliliters. Right here. All my flushes ready. I'm going to scrub the hub for 5 seconds. Push. Scrub again, 5 seconds. Using my second hand. I'm going to scrub the hub again, port, I should say, for at least 5 seconds. Very important. I'm going to give this final flush over the same rate that the medication was given. So I have to give it over 5 minutes. Using a second hand clock in the room or my watch.